All right. Hi, everyone, and thank you for joining our webinar. Today, we will be discussing how to craft a career for yourself in home care. I'm Ilaria, and I'm onboarding customer success manager here at Nursebuddy, and I will be your host for today's session. With me is our very special guest, Liz Blacklock. Liz is the CEO of NACAS, the National Association of Care and Support Workers, as well as the domiciliary care provider, Lapis Care. Liz is a passionate advocate for recognizing our incredible social care workforce and a well-known voice in pushing for positive change for care professionals. A very warm welcome to you, Liz.
Thank you for having me.
Today's webinar will be slightly different than others in our series, as it will be a question and answer session throughout. Please use the Q&A feature in Google Meet to ask a question to Liz. Click on the activities icon at the bottom right of your screen. It looks like three shapes. And then choose Q&A. If you're on a mobile device, please click on the three dots in order to see this. Type in your questions, and we'll do our best to get to as many as possible. We're also recording this session, and we'll mail you a link afterwards. Nice. So now we can start the conversation. So Liz, thank you again for joining us today. We really look forward to hearing what you have to say. So could you please start by telling us why you're such a passionate advocate for care as a career?
So thank you for having me again. Why am I a passionate advocate for care? Because it's always that vision, isn't it, when you see things and the way things are being done and how you want to make a change. And I've always been a person that wants to make a change. I'm not being very good at sitting on my hands and just watching the world go by. So I started out, my background is a nurse. I started out, I've just been writing my CV actually. I started out many moons ago, and I was a community nurse. And essentially, it was in the what we call the bad old days of social care, where there were people running around left, right, and centre, and there's 0 hours contracts, and all trying to split themselves across, 3 different places at once. And in the middle of it was that patient, my client or patient, saying that my carer hasn't turned up, I'm thinking there's got to be a better way. So essentially, not quite at that point, we moved on and thought, well, let's give it a go. And then we've evolved, and we always tried to do things differently here. We never went down the paying only for contact time, because didn't make any sense to me. And also I like to sleep at night, and I wanted to know that my clients were going to get the care in the morning. So we started off at the very outset doing block care, as in, so someone was started at 7, or they'd start work at 7 and finish at 2, so they'd be paid from 7 to 2. And just time has evolved, and with all the political goings on, it's always been, what can we do to make this better? And then gradually, as we've had a team, we've got a good team, and wanting to help them thrive and give them the wings to thrive and fly. And if you can help someone, is you don't want to lose good team members, but if you can help people get ahead in care and then move on to bigger and greater things, and then that's what we do. So that's why I'm an advocate.
Lovely. Thank you, Liz. I really like how you said you had a vision and then you draw from your personal experience in order to make a positive change. So thanks for sharing that. And as you know, we have an audience with us today of frontline domiciliary care professionals. So where could you get in a career in care? Is the sky the limit?
The sky is the limit, absolutely. I think we have to think. Let me start again. I'll eat my words again. Sorry. When I started my nursing training, so 40 years ago, social care was never an option. It was never given to me as an option. I didn't even know it existed, apart from when you go and see your granny in a care home, which is not, it's certainly not, it was never a career of choice. It was just, probably in hindsight, I would probably, if to ever have my time again, I would probably go into care now, not nursing, because nursing has become so academic, and I've never been an academic. I think some people just want to go out and do a good day's work for a good day's pay, know that they made a difference to their client, have a bit of a laugh, a bit of a giggle. Some people want to climb the career ladder. And there's the option. So you could just come out and get a career. We have clients, we have staff members who have come into care because they've looked after their members of their family who have sadly gone to other places. and want to carry on doing that work. They've enjoyed it so much. They've come from completely diverse backgrounds. Some actually want to go on and climb the career ladder, and by which you mean you do your care certificate. You then go and do your level 3, which we know that skills for care are trying to combine. And so that is always going to be the basic, because it's so important that there's an element. We've got to make sure that everyone delivering care has that basic element of care, because people forget actually there's no such thing as just the carer. You don't know what you're going to walk into on a daily basis, and there's got to be an element of underpinning and knowledge. And knowledge is power in terms of knowledge and confidence. And if you've got the knowledge, and then you can go on and do your level 3. Apprenticeship used to be the MBQs, level 5, and then you're going up the management ladder into you can go and become a director. I mean, I kind of fell into it. I mean, I'm a director, but not because I climbed the ladder through another company, just because I owned a business. Or you don't have to. You can just stay where you are, go out and do a good day's work, and for a good day's pay.
Yeah, I guess maybe just building on what you were mentioning, because of course we have a lot of care professionals with us today. So maybe could you share some advice on how you go to building that career? As you said, it's a personal choice, right? But if you could share a bit more, that would be lovely.
We for starters, we need to start attracting people into care. We have to, because there are going to be a lot of gaps in the future. And so we've got to start changing that whole narrative of what care is, and the negative to that of just the care of really poor, low paid, underskilled work to a really strong career of choice that anyone can do if, and foster those relationships. And we've got to start, I've started going into primary schools to try and talk about care, because they're going to be the carers of our future. And we need to start telling people that this is a career of choice. But essentially, there is the way we do it here, and I know for a fact that Lena, my registered manager, has just joined us because I saw her name pop up. Hello, Lena. Basically, she's a classic example. Lena came to me as a carer and is now my registered manager. So that's a case in point. So basically, you would go to a company with hopefully they will get you on the care certificate, especially if you're inexperienced, to give you really good grounding in those very basics, get you the time to fulfill find your way, get your probation out of the way, really. So especially if you're new to care, start to get a feel for the sector and what it means, and then you, through your supervisions and your IPRs, sign you up for a level 2 or possibly a level 3, depending on where you are, because actually sometimes you can jump to level 2. Some people are quite academic and don't necessarily need to do a level 2. Go straight on to the level 3, and then essentially that is kind of a senior role. So, and I've seen a senior carer, team leader type role. And then essentially they can do a level 4, but actually people tend to go straight to their level 5, which is what you need to have as a registered manager. If you want to manage a team or a business, manage and be the CQC regulated person, nominated CQC legal person, as in you're legally responsible. Alongside the nominated individual, and that's running the company. You can then do as much or as little as anything after that really is down to choice. You can go off and do as many degrees if you want to, but in terms of career escalation, if you're going to be a director or something, if you're up that corporate ladder, there is a level 7 you can do. That's more about leadership and strategic decisions really. But really, it's a level 2, level 3, level 5, and then off you go.
Yeah, thank you, Liz. Do you think that outside kind of the work environment, are there any other training and learning opportunities?
Oh, there's loads and loads of training. I mean, I think it's there's just so. I mean, NACAS itself, we've got several training platforms, and it all depends. Everyone has their own special interest, don't they? I mean, some people prefer the clinical, the more hands-on, the physical, the peg feeding, the diabetic care, the skincare. Other people prefer more theoretical dementia care, kind of long-term condition care. There's literally a specialty for everyone. I think ideally, I think for companies to have champions of different, having a dementia champion, having an end of life champion, so you really support those people in those really tough, challenging times that you're looking after. And also families. I mean, we forget about the families, don't we, that are looking after how many families are keeping those people out of hospital and with our support, and they need huge amounts of support.
Yeah. Thank you, Liz, and thank you for touching on NACAS. I just actually wanted to ask you about it, but before we dive in, I just wanted to remind the audience to please write your questions. I can see a couple came through, which is lovely. Please use the activity sessions. It looks like 3 shapes, and then you can write your questions there. But yeah, so thank you so much for mentioning NACAS. Could you tell us a bit more about what the organization does?
So NACAS, we are the professional body for care. So if you think about the Nursing Midwifery Council for nurses, or the GMC for doctors, we are the professional body, essentially. So there is an element, we are currently we have launched and are managing the voluntary care professional, the care professional register for England, because for some unknown, inexplicable reason, there is no register for care in England. So there's one in Scotland, Ireland, and Wales. And if you by register, I mean, in healthcare professionals, nurses, doctors, they're mandate that's a mandatory law. It's a protected characteristic, and you can't impersonate a nurse or doctor. That should be the same in care, because there are too many negative stories in care, and it's very easy for people to impersonate. And we have to regulate that, and we have to give the public confidence and trust. If you think about the things that we're going into people's and doing the most intimate, personal tasks into people's lives, and they have to know that they can trust us. And unfortunately, within the press, etc., you only see the negative stories. You never see all the good work that's being done out there. So people have to have a place to go. There's a lot of what we call the PAs. We represent a lot of PAs who are not regulated at all, as in you could just get a DVS and just go off and do care. Now, obviously, there are some amazing PAs, but there are also not so, like anything, not just PAs, any carer. There's also the bad eggs, and we have to give the people trust that they know that the person that they're getting is trustworthy and reliable. So that's what we do. We have a number of membership platforms that offer all sorts of benefits. Training's one I've just talked about. Some also sort of insurance benefits, some legal benefits. So EAP, depending on lots of fact sheets, facts and information, depending on the level that you we have a gold, silver and bronze membership. And then aside from that, of course, we're doing the register. And the register if carers want to stop being just the carer, as much as we can promote it and we can talk about it, there is also accountability. People have to, if they want to be taken and respected and recognised as professionals, they have to act as recognised professionals, and that comes with accountability. And you have to almost a bit like the branded guide promise. Because it's not a mandatory register, and at the moment it's only voluntary, it's going to be very much self-regulation and you register yourself, and then if there's an issue, you own it. Because it's not about throwing people off, it's about supporting people to be the best that they can be, to the client can receive the best care that they can receive. We have a duty of care to the clients to ensure that they get the best care that they can.
Absolutely. Thank you so much, Liz. And now I think it would be nice to take a few questions from our audience. So someone has agreed with you on the importance, in talking in primary schools, and they would like to hear a bit more from you in terms of how you can really make families aware that this is a profession and not just a job, because it can create very inspiring conversations.
How can I have to say it's a tough one. It is a tough one. How can I make because social care is misunderstood, and it is a conversation I have every single day. How do people understand that it's not just washing a face or helping someone, have a wash? It's if you think about the way I describe it, you walk in, and we had a situation here just at Christmas. You do, and it doesn't matter whether you're in domiciliary care, whether you're in a care home. Essentially, you're a lone worker. You're a lone worker. You have to think on your feet. And actually, my team will laugh at me. I don't go out, as I call it. I don't go out and play very often because I'm doing a lot of this kind of stuff and a lot of work behind the scenes. I think they don't let me out very often because I'm probably, in terms of hands-on, a bit slower. And a lot of my team, as much as I've got my registration behind, my nursing registration, because I'm less hands-on now, it's probably, I'm more advisory. But I'm equally very, very aware that you do not know. It was the thing that started me off. I have always tried to put myself in their place. How would I feel if A, B, or C happened? How would I deal with that? You do not know what you're going to walk into. You do not know. We had a situation at Christmas, 7 o'clock in the morning. You do not know what you're going to walk, whether that's in someone's home or in a single room in a care home. You could open that door and the whole it could have changed on a sixpence, and you've got to think on your feet. What do I do? How am I going to cope? Who do I tell? How do I help this person fundamentally, first of all, before I even get down that road? And that's the accountability. That's the professionalism. Because one of my team members, sorry, Lena, who's just done a level 3, we had quite a conversation about how it changes your thinking from being just going out and doing the basics to how you're having to strategize and constantly think all the time. What am I doing next? What am I doing next? Managing your time, which managing your rota, getting from A to B. There is no just about it.
Yeah.
Does that help? Would you like me to go on?
Well, actually, I had something a bit related on this, in the sense that someone also brought up what kind of other attributes you look in a care worker, because of course qualification, they can be important. Do you think they have like a big weight, and what are other maybe attributes?
So when you're looking for a care professional, it's all in the personality. It's about their willingness and to learn. Some people come in, like I've just said, some people come into care from nothing, from just say that word again, from looking after a family member. That's the only experience that they've got, and they want to carry on. It's a lot of it is gut instinct on our part. Sometimes, it's why we need that register, because the recruitment process is long, it's hard. You've only got the DVS, which takes forever. To be honest, it's about it's about relationship building. It's it's something called the mum test. What do they do? What would you do in this situation? If this is your mum you were looking after, what would you want to happen? How do they respond to those questions? It's very values based. It's not about having, like I've said, it's not about having all the qualifications. Just because someone's got a bunch of qualifications doesn't mean they're a good carer. It's about how tactile are they. Does a client want to talk to them? Can they hold relationships? Can they have a bit of a giggle? I mean, what the clients that I go to, and I still do go out sometimes, is we have laugh. It's being able to build those relationships and talk. Yeah, Lena's up here now.
Yes. No, that's lovely. Thank you, Liz. And do you have any advice for care professional on how to speak to their managers about their careers aspirations?
Sorry, can you just repeat that big one?
Yeah. So do you have any advice for the care professionals to discuss their aspirations with their managers in terms of their progression?
Essentially, the carers basically have supervisions every 3 months, and then they have an IPR every year, which is where they sit down with the manager and they say, well, this is what I'd like to achieve. These are my interests. I don't actually like this very much. Could I not do this? And I want to go off and do this qualification, and that's where, But I mean, the way we operate is we have an open door. Lena has an open door, and it's constant dialogue all the time. I mean, yes, of course, we go down the formal route, but equally, there's it's the general chatting over coffee. Actually, what can I do? How do I make this better? But yeah.
Great. Thank you, Liz. I think another question that I wanted to touch upon is about the CPD portfolio. Do you believe it's a good idea for professionals to have one, and maybe sharing some guidance on how they could get started?
I mean, obviously everything nowadays is fairly electronic, which is easier. There's a lot of the, it's really important to have CPD. If we go down if we go down the register perspective and we go down the verification, I'm hoping what will happen in the long term as we develop it, that their CPD they'll have, which will be a lot better than the nursing or the GMC, which is just a line and a PIN number. They'll have their own portfolio that they can manage online. But any training that they do will be evident, and the certificates will be evident that they've done. So I think it's really, really good. And I think any CPD folder, because is amazing, because it gives an employee the chance to see what experience that they've got. How they can integrate in the team, how they can support the team, and then it impacts on the clients perhaps that you would take, because so-and-so's got experience in one thing, so-and-so's got experience in something else. So yes, it's really really important. And also it goes back to being just the carer. Actually, we all have our CPD folders, we show the other medical professionals that talk down, hang on a minute, I've got experience in all these different areas of clinical knowledge. And again, it's about, we've got to have a parity with the NHS. A lot of the work that historically was done in the NHS, it's going to be coming into the community. So we're going to be a lot more clinically hands-on in the future than we have been historically. So, and again, just because you've got a quality, it doesn't necessarily, it's about having those qualifications, and is it like anything, and that personality to marry the two together. Having just been, it's about compromise. It's not one or the other, it's having how they interlink together.
Mm-hmm. Yes, actually, something from the audience, which I think would be interesting, as we were mentioning before about the professional register. Do you think one will ever become mandatory in England?
Do I think, or do I hope? I hope, yes. And if I have anything to do with it, then it will be. Because I'm batting, and we are, working at it all the time. Time frame, I wouldn't want to say. I have to say there's not a lot of interest in it, and then I don't quite know why it hasn't been done. It's a really huge chestnut in James, and I think, what on earth are we doing? It's a massive, because obviously again, care is so diverse. It's not like, nursing, you've got registered nurses and you have some specialties where you children or learn. It's a lot more cohesive. Care is diverse. There's so many different facets of care. I imagine that's why it's not been done in the past. But I think they're going to have to be honest. If they want, as part of the social care reforms, they are going to have to do it. I don't know when, and I don't know how long it will take, but I think that if they want to bring up, and they want a proper health and social care system on a parity with each other, so that they interlink and collaborate, they are going to have to make it mandatory. But unfortunately, we as a cohesive group of carers who care and want to professionalize and get that recognition, it is on us to prove the need and prove the want as a profession, because that's the way we need people on it. Because the only way, apart from we do some research, and I'm hoping to work with people, some of the Skills for Care King's Fund, I'm hoping I'm going to get in touch with, so we can get some qualitative research. Mm-hmm. There is some ambiguity about it. Not everyone's in favour of the register, and I think it's fair, because it's how do you quantify, it goes back to what I was saying earlier, how do you help someone understand who's not used to being registered what it means. For me, it's a real integral part of who I am, but I'm used to that. I've always had that registration. Not everybody has. How do you quantify that to somebody? However, if you want a really truly collaborative health and social care system that work, I think they're going to have to, but I think that's going to take a bit of convincing by us.
Yeah. Thank you, Liz. You explained a bit before about NACAS, so thank you very much. But I was thinking maybe we could use just the last couple of minutes of today's webinar for you to tell us a bit more how the care professionals could, sign up, and does it have a cost involved as well?
It does have a cost, and I really hang on. Yes, there is a cost to join NACAS. There are several ways you can join. There's silver, bronze. Sorry, I've started with bronze, silver, and gold. And as I said before, there are different. If you gold is like everything, you get every single possible thing that we offer, and you get some face-to-face advice. You can get lots of sort of training. It's the maximum, and silver is somewhere in between the more fact sheets, and then the bronze is kind of access to training without a doubt, online training, but less as it says on the tin. We're changing all the time. We're working with different partners. We're always looking to partner with people for the benefit of the care. We partner with the Blue Sky Social Care Card, which is a little bit like the Blue Light Card. We partner with different insurance companies. There's legal advice that you can get pro bono through us if it's needed. God forbid, there's all sorts. Thank you, Jane. And yes, and then obviously through that, if you want to join, it's just a case of it's a small monthly fee, and it goes from somewhere between £2 and £5 a month. It's small for what you get, very, very good value for money. And then basically it's just going to register onto the website and just signing up. In terms of, there's also a corporate membership, which means that that's how I found it. I joined my whole team up, and as a corporate member, you get the gold membership, and your employees are the members, and they get everything as part of that, as part of an employee package.
Lovely, thank you. Thanks, Jane, as well for sharing. I was about to mention that there is more information available at nacas.org.uk. But thank you so much again, Liz, for sharing your insights, for this very passionate discussion. I'm feeling inspired. I've learned a lot, and I hope it's the same for our audience here today. So thank you again, everyone, for joining, and take care. We'll see you in the next one.
Thank you for having me. Bye-bye.
Bye.